This is KSTECH News, the authentic and factual side to get recent updates. The vaccine for COVID-19 is out, and it was ready on the 24th of February 2020. But due to past experience, an example is the 2006, the TGN1412 vaccine clinical trials on humans, that resulted in severe inflammation reaction in the first human study. We had to go through a series of a number of proceedings or number of steps before it can be brought out to the public that the vaccine is actually out and is ready for trials. The researchers in the United States are actually working very hard as US has stepped in over $8.3 billion to help in this. And the Bill and Melinda Gates, that is Bill Gates and his wife foundation and other philanthropists across the globe also helping in this has also resulted in a lot of success. So the first clinical trial has actually started, and we have 4 participants that has undergone it, and one of the participants is called Jennifer Helen, and according to her, this is a time that actually need the help of people, and he realized there is no hope, so he just volunteered to help. So we've heard a lot of people speaking about this vaccine. We've heard from Dr. John Brownstein, who is a chief innovating officer of the Boston Children's Hospital, who said that though the vaccine is out at the clinical trial stage, but then we are still at the early stage, and even if we are able to succeed, we have about 12 to 18 months before the vaccine could be used generally on the populace on this planet. So according to him, we still have a lot to do because we need to actually consider the safety and other factors before we can actually roll this out. So the Trump also said this in their briefing on the COVID-19 in the press, and as you also heard from the director of National Institute of Infection Disease of the United States, that is Dr. Anthony Fauci, also made mention of that, and that we are hoping that it actually yield good results. And I believe it's actually great news because Kaiser Permanente Company or Washington Research Clinic has actually done well. So we need to actually applaud them and pray that it actually yields good results. So with this said and done, usually when we have to make vaccine, there is this traditional mode that is being applied. But this time we are using a modernized mode. That is, we are basing on the messenger RNA, which means it's going to be very, very fast, and the risks involved is going to be very, very minimal. So according to Kaiser Permanente, you are saying that they are looking for volunteers for this clinical trials, and before you'll be able to undergo this clinical trial, you should be someone who is in the age of 18 to 55 years. You should be healthy, and you must have 4 phone visits over a 14-month period. That means if you actually want to undertake this clinical trial, or you want to actually be a participant, then within the 14 months you need to just undertake only 4 phone visits. So when you are actually accepted, you first go on initial screening. After the initial screening, you take in 2 visits or 2 vaccine visits. After that, you have 8 follow-ups, and then if you complete this successfully, you'll be given an amount of 1,100 United States dollars as a remuneration for you being a participant for this vaccine test. So according to the institution, or according to the researchers, they are saying that this type of vaccine is made from a nucleic or a nucleic acid. According to Kaiser Permanente Institute or Research Institute. So according to Kaiser Permanente Washington Research Clinic, they are saying that this vaccine is made from a nucleic acid, using a faster method for creating, and it cannot cause illness, and for that matter, it's actually very free and very easy to undergo. So they are saying that the messenger RNA is a genetic code that tells the cell how to make a protein that is found in the outer coat of the coronavirus. And when it is injected into the human body, it causes the cells of the human body to make protein which could cause an immune response to this COVID-19. So they are saying that the messenger RNA will break down or to digest itself. That is, after it has been able to build the immunity in the system and to leave the system. That means it will be in the system and it wouldn't cause any illness. Previously, we are always made to understand that when we are making vaccine, we actually are keeping a killed or a lower or a depressed or a weakened van, okay, like a weakened disease into the system. But this is different. This is actually made from a nucleic acid, okay, and we are using the messenger RNA base that is very fast and very secured. So, folks out there and anybody listening to KSTECH News, if you actually want to undertake or participate into this clinical trials, then you need to consider these things. You should be healthy. You should be between the age of 18 and 55 years. And then you should or you must have at least 4 phone visits within the 14 months period. And the steps are: 1, you have first 1 initial screening, you have 2 vaccine visits, and you have 8 follow-ups. And then if you undergo this thing successfully, then you'll be given an amount of $1,100 United States dollars as a remuneration. So first of all, you'll be given 2 injections in the arms over a period of 28 days. So within the period of 28 days, you'll be given 2 arm injection. Okay, that is the vaccine within the arms. And after that, there'll be different test groups that will get different doses within the period that is being stated. So we'll be giving you updates as and when it's ready. So kindly remember to subscribe to our channel, and don't forget to share our videos to other people or the general public for the benefit of everyone. Thank you very much, and stay tuned for more.